Hi, I'm Ardys. My husband Tim has Parkinson's disease and has had it for 12 going to 13 years. And we've been coming to Dr. Brian and Dr. Nate now for the last few months, since September, and are pleased with the results that we're seeing. So much so that I'd like to share what I've written in my Christmas letter regarding progress from year to year. In early March, after 6 months of a serious diet low in sugar, gluten, and preservatives, light therapy, glutathione, pro-arginine, Tim regained significant cognitive skills. Upon it first occurring, I didn't dare tell anyone for fear that it would be gone the next day. However, as the weeks went on, it seemed to be sticking. It did not come back to engineering status, but the short-term memory improved, the reasoning improved, interest in life came back, along with his sense of humor. We're very grateful, and he began planning our next trip, this time a motorhome trip for the spring. The trip we had taken in January prior to this, to Florida, he basically came along. This time, he orchestrated the days, the distances, and all that good stuff. Further on, another another trip I shared was in October, we visited Door County in Wisconsin. He complained a great deal about a sore bone in his foot, and it kept him from walking a lot of the time. He did, however, climb a 100-foot viewing tower, which was one of his exceptional days, but mostly he was experiencing pain. And when he mentioned this to Dr. Nate and Dr. Brian, they encouraged him to try laser therapy on the feet and suggested oxygen therapy to bring up his oxygen levels and then further brain exercises. After a month of these treatments, this was amazing, the feet were improving, but the shocking part was to us that he no longer needed to take his regular doses of a Parkinson pill, Cinemet, that he had been taking for 12 years every hour and a half while he was awake. First, we reduced to half a tablet and stretched the time out. However, as the weeks went on, the dyskinesia, which means the facial contortions that indicate you've taken too much medication, was still an issue. So right now, he is down to a half tablet in the morning. He is still needing the blood pressure meds to maintain a fairly stable level there, but not taking the Cinemet constantly is a shocker to his daily routine. After doing this for 12 years, his deep brain stimulator is able to carry him. In the middle of all this, though, life is frustrating with Parkinson's, even if we see improvements, which is extremely exciting. On days when we become frustrated with the disease, and he grows tired of me reminding him to take big steps, hold his head up, close his mouth, and so forth, we are using this image that just God gave to me one morning as I woke up in frustration. There are really 4 people in our relationship. There's me, Ardys, there's the caregiver, therapist, me also, but not the artist part, Mr. Parkinson, and Tim. So we've got the 4, artist, caregiver, therapist, Mr. Parkinson, and Tim. We both don't really care for the 2 people in the middle of our relationship. The caregiver therapist needs to be functioning to help Tim succeed. Mr. Parkinson is not there by invitation, but he is there. Tim and Ardys are still there, as they always have been, and they do like each other. As odd as this may sound to you, this tool has helped us place our frustrations appropriately. We're very grateful for that insight as well. But as we look back to the therapies that we have gained here at the clinic, we are so grateful to Dr. Brian and Dr. Nate, who are willing to step outside the comfort zone and are researching and investigating both products and methodologies that are helping Tim have the healthiest body and brain that he possibly can, even as the disease is working to try to shut him down. So we are so grateful. Thank you, guys.
Hi, my name is Jill Gibson. I've been coming to Brian's clinic for the last 2 to 3 years, and I've had such great benefits in my life. I can't begin to think about all the ways it's been impactful. I currently suffer from MS. I've had it for 18 years, and frankly, he's helped me stay asymptomatic and actually correct some of the things that have been long-term issues, which has been amazing. Frankly, I can't see me ever not attending or coming and seeing Brian on a consistent basis going forward in my life. I would recommend anybody coming to see him, and he would definitely work with that person to find the best solutions possible for the best life possible.
Hi, my name is Marlis. I started coming to Dr. Brian about 6 months ago, and since I've come, I feel like I've gained a lot of range of motion, more than what I had before. I do have Parkinson's, so I'm concerned about losing that are getting more rigid, and I feel like this has really helped me out in a lot. And so I plan to continue. And I want to thank Dr. Bryan for all he's done.
With your customized therapy, you'll have improved blood flow and nerve conduction. This therapy will also trigger your body to decrease your pain and inflammation, increase normal sensations, and regenerate your nerves and tissue through increased circulation. Therefore, your burning pain and numbness symptoms will generally improve. This treatment will not mask your symptoms with medication. It will reduce your symptoms without side effects. But because nerves regenerate slowly and everyone improves differently, this program may take up to 36 sessions. Your condition developed over a long period of time, and now it will take some time to reverse its effects. Your symptoms should continue to improve for approximately 6 months, because remember, nerves regenerate slowly. Because the symptoms of peripheral neuropathy appear gradually and over a long period of time, many people ignore them, sometimes for a decade, and not everybody experiences the same symptoms at the same rate. Classic symptoms that may indicate peripheral neuropathy are pain experienced as tingling, burning, electric arcing, sharp needles or the sensation of insects biting, sleep interruption, typically between 2 a.m. and 5 a.m. due to foot pain and limb coldness, inability to feel pressure or temperature changes, difficulty in walking or unexplained falls, and a fear of falling. Commonly reported causes of peripheral neuropathy are diabetes, chemotherapy, and statins, which are cholesterol drugs. People with any of these 3 contributing causes to peripheral neuropathy generally respond very well after using HealthLight to increase local circulation. Clinics usually offer a plan of care including some or all of these: an initial 45 to 90-minute comprehensive neurological consultation and physical assessment, a gait and balance assessment, a sensitivity test, and a treatment care plan consisting of 3 visits per week for 8 to 12 weeks, HealthLight infrared light therapy, nutritional supplementation, vibration plate, and gait and balance retraining. After your treatment is completed, what next? Consider a lifestyle checkup, exercise now that you are able to, maintain a good diet and sugar control, and ensure your symptoms don't return by using a home care system. You can probably start your improvement process today.